Hey guys, so I just wanted to demonstrate with a TheraBand here how the linea alba is influenced by the way that our rib cage position is, and then ultimately that it's going to have some sort of effect down onto the pelvic floor as well. So if we think about that linea alba, the linea alba is the connective tissue lining between the two six-pack muscles. During pregnancy, the linea alba gets very stretched out, and it makes a lot of sense. We need some growth and movement to happen somewhere inside of the core system here. So it's absolutely going to be happening through that linea alba there, as well as some of the muscles, the six-pack muscle and our obliques. Everything does generally get more stretched out all around here. So why this is important is because postpartum, we do want to set ourselves up for optimal healing, and where our rib cage position is going to affect this tissue through here. So taking this TheraBand, I'm just going to place it right at the bottom of my sternum here where that linea alba generally starts, and then it comes all the way down to my pubic bone. So we have that tension through the system just normally here. Now as the baby grows, I'm going to get a stretching through that system there. So now it's more stretched out and actually a little bit more thinned because it was stretched. Just think about a rubber band. So postpartum, once that baby we have delivered, we want to make sure that we think of keeping that rib cage position down a little bit more to help take out some of that tension going through the system. So really common when I'm holding my baby to kind of be back in this sort of a position here where now my rib cage is arched and flared. It keeps that tension in that linea alba there. If I do think of, okay, just rib cage down slightly, I don't have to come all the way down forward here and just kind of feel really, really tight. But if I'm just kind of mindful of slightly down, so I'm getting out of tension and then just slightly down, that's going to help promote optimal tissue healing for my pelvic floor and my abdomen. And then also where that pubic bone ends, where that linea alba ends, if I'm tipped forward a lot, that's also going to affect that tension through that area too, increasing more pressure potentially on that linea alba. So I do want to think, okay, just a little bit of pubic bone slightly coming towards my sternum there, just a little bit. It's not a lot. Again, I'm not crunching and totally being here, just thinking slightly down with my rib cage.